So first let's talk about a rib out. When people talk about a rib out, usually there's an acute point tenderness pain um, on the side of the spine. So it's not directly on the spine. There's no point tenderness on the spine. It's usually sort of an area over here, which you actually feel tissue texture changes and heat over those areas. You might also find a lump in the area where the rib is out. And essentially this is a subluxation of the rib. Although there's many ways to put this back in, the best way actually is with high velocity, low amplitude technique. What I usually would recommend for a beginner is to actually do the Texas twist. And so we're essentially going to contact the area where that is. We're going to go on both sides of the spine. We're going to twist over that area. We're going to have our patient take a deep breath in and all the way out. And as she reaches the bottom of that breath, I do my impulse. We're going to talk about inhalation and exhalation dysfunctions. And the way we do this is we contact the patient's ribs, and then we ask them to take a deep breath in and a deep breath out. What you'll find is that one rib, usually the point of tenderness, will actually either move better up or better down. Remember, we name these in E's. So if the rib stays up, that would be inhalation, and if it stays down, it would be an exhalation dysfunction. People often confuse these terms back and forth. In my case, I think this is just an easy way to deal with them. What we're going to try to do is we're trying to actually use a direct technique against it to make it go the way we want it to go. So in this case, we'll suppose that this rib is something that will only stay up. So what I'm going to do is I'm going to contact above that rib, ask the patient to breathe in, and I'm going to resist that movement. And then have them breathe out again, and I stay down. And I'm going to try to steadily push this down against the patient's respiration. So I take another deep breath in. I'm going to hold it down and then relax, and I'm going to not give up any ground. Sometimes you can also have the patient lean into it, which can help contact the rib better. If you were going to do an exhalation dysfunction, it'd be the exact same thing, except you'd be trying to hold the rib up rather than push it down with breaths.